Hello students, welcome to iReach. In today's lecture, we are going to discuss about the blood supply, nerve supply and lymphatic drainage of the liver. So let's get started. First, we'll discuss about the arterial supply. So the liver gets its arterial supply 20% from the hepatic artery and 80% from the portal vein. This is the very important point that you have to keep in mind, that the liver gets its arterial supply from the hepatic artery by only 20% and 80% of supply is through portal vein. So here hepatic artery which is coming from a systemic circulation, consists of an oxygenated blood, and the portal vein here consists of the nutrient rich blood. The blood in the portal vein is coming from the intestine and stomach, and here the blood is actually the nutrient rich blood, but this blood is deoxygenated, but it has the nutrients which are essential for the liver. So 20% is from the hepatic artery and 80% through the portal vein. This is the most important point that you have to keep in mind. Let's understand how this circulation occurs or arterial supply given to the liver. So firstly, the hepatic artery and the portal vein both enters into the liver through the porta hepatis, and after entering into the liver, first it divides into the right and left branches. Both of these, that is hepatic artery and portal vein, both divide into the right and left branches, and then within the liver there are presence of lobes. We know that the right and left lobes. So first they divide into the right and left branches, then within the liver they divides into the segmental vessels. That means there is further division of these right and left branches of both of these vessels, and then they are again divide or subdivide into the interlobular vessels. That means the vessels that enters into the lobes of the liver. So first there is right and left division of both the vessels, then they divide into the segmental vessels, and then there is further division of the vessels when it enters into the lobes of the liver, and there it is called as interlobular vessels, and further ramification into the hepatic sinusoid. That means interlobular vessel then again divide into the hepatic sinusoids. So what is actually hepatic sinusoids? Hepatic sinusoids are the capillaries or the network of capillaries which are formed by both of these vessels. That is, first the hepatic artery and second is the portal vein. Both of these vessels form this network of capillary which is called as hepatic sinusoid. So what we have seen, first there is branching of the right and left branches, there is division of the right and left branches of both of these vessels, then right and left again divide into the segmental vessels, then the segmental vessels enters into the lobes of the liver and they again divide, and there they are called as the interlobular vessels, and then these interlobular vessels again divides or again ramification of these vessels leads to the formation of hepatic sinusoids, which are actually the network of capillaries formed by both of these vessels, that is hepatic artery and portal vein. Then here in the hepatic sinusoids, the hepatic arterial blood mixes with the portal venous blood. So here in the hepatic sinusoids, blood from both these vessels, from the hepatic artery and from the hepatic veins, get mixed with each other, and then this blood, then at this point the liver takes its essential nutrients from that blood, and at this point the hepatic sinusoids drains into the interlobular vein. So hepatic sinusoids, after the blood mixes with each other, the liver takes the essential nutrients and then the blood is drained from the hepatic sinusoids into the interlobular vein. Okay, that is present inside veins present inside the lobes of the liver. Then after the interlobular veins, the blood drains into the sublobular veins, then to the hepatic veins, and then finally to the inferior vena cava. So these are all the series of events that you have to keep in mind regarding the arterial supply of the liver. That the firstly, the arterial supply is 20% by the hepatic artery and 80% by the portal vein. And then both of these vessels first divide into right and left branches. They enters into the liver through the porta hepatis. They divides into the right and left branches, and then into the segmental vessels. Further division is into the segmental vessels. Then the segmental vessels again divide to form the interlobular vessels, and then further division of these interlobular vessels will lead to the formation of the hepatic sinusoids. Then in these hepatic sinusoids, which are the networks of capillaries formed by both the vessels, here in the hepatic sinusoids, the arterial blood and venous blood mixes with each other. The liver takes its essential nutrients, the tissues of the liver takes its essential nutrients, and the blood drains from the sinusoids into the interlobular vein, then into the sublobular vein, then into the hepatic vein, and finally the blood drains into the inferior vena cava. So these are the series of events very important that you have to keep in mind. Moving on, next is the venous drainage of the liver. So the venous drainage is done by the hepatic veins. So in case of hepatic veins, you have to keep in mind that there are two groups of hepatic veins present inside the liver. First one is the upper group and the second one is the lower group. So here upper group consists of three large veins, which are the right, left and middle vein, which you can appreciate here in this picture. This is the right vein of the upper group, this is the middle vein of the upper group, and this is the left vein of the upper group. Okay. And lower group consists of the numerous small veins. The lower group consists of numerous small veins which are not clearly visible in this picture. So you have to keep in mind that the hepatic vein consists of two groups, and upper group and lower group, and the upper group consists of three large veins, which is the right, left and middle, which drains the blood from the tissues of the liver and then finally drained into the inferior vena cava. And the lower group consists of numerous small veins which also drains into the inferior vena cava. So moving on, next is the lymphatic drainage of the liver. So there are two types of lymphatics present on the liver, the superficial lymphatics and the deep lymphatics. So firstly, the superficial lymphatics runs on the surface, that's why it is called as superficial lymphatics, beneath the peritoneum. That means below the peritoneum. Below the peritoneum, this superficial lymphatics runs on the surface of the liver and it terminates into the caval, hepatic, paracardial and celiac lymph nodes. So these superficial lymphatics drains into the caval, hepatic, paracardial and celiac lymph node. This is the important point that you have to keep in mind. And the second one is the deep lymphatics. So by the name deep lymphatics, that means it is present deeply inside the liver and it ends partly in the nodes around the end of the inferior vena cava. At the end of the inferior vena cava, there is presence of lymph nodes, and these lymphatics drains into that lymph nodes which are present near the inferior vena cava and partly in the hepatic lymph nodes. So deep lymphatics ends partly into the towards the end of the inferior vena cava to the nodes present near the end of the inferior vena cava and partly in the nodes of the liver, that is hepatic lymph nodes. Okay. Next is the nerve supply. So the liver gets its nerve supply from the hepatic plexus of nerves. The important thing you have to keep in mind that the liver gets its nerve supply from the hepatic plexus of nerves, and these hepatic plexus consist of both sympathetic and parasympathetic fibers. Okay. And here parasympathetic fibers are derived from the vagus nerve. This is the important point, that the parasympathetic fiber is derived from the vagus nerve, and the hepatic plexus of nerve consists of both the sympathetic and parasympathetic fibers. So that's all for today's lecture. I'll see you soon in the next lecture. Until then, keep reading and don't forget to subscribe, like and share. Thank you for watching this video.